Okay, Philip Lupote, a 2-year-old boy whose parents reside in Sesheke, is admitted to your ward with a confirmed diagnosis of measles. There is an outbreak of measles in Sesheke. First, define measles. State 5 diagnostic signs and symptoms of measles. Explain your assessment and the classification of measles using I.M.C.I. Discuss the management of baby Philip. Discuss the management of baby Philip until discharge. Then explain 5 preventive measures that you would undertake in order to prevent the spread of measles in the area where baby Philip comes from. Okay. Then the answer, we'll start by defining measles. Measles is a highly acute infectious condition, which is also known as rubella. It is caused by the rubella virus and it's characterized by body rash, fever, and red eyes. Okay, or if you want, we can say that measles is also known as the mobile or rubella. It is an acute, highly contagious disease of the spots, mainly in the mouth and the cheeks, who appear as some form of extensive rash, maybe basically in the catarrh stage. Persistence fever due to the presence of the virus. Conjunctivitis due to the presence of the virus or invasion of the conjunctiva. Then nosocatarrh, or a running nose, that is due to the inflammation of the epithelium of the respiratory tract. Photophobia is a common sign and symptom, and due to the the inflammation of the eyes. Of course, cough, that is as a result of the inflammation of the respiratory tract. Then, of course, an individual is going to present with rash, mainly on the face, the forehead, behind the ears, the trunk, and the lower limbs. Okay, so that is that. Under the assessment of using I.M.C.I, the first thing you should do is ensure that first the mother is made comfortable, ask the mother's problem, and determine whether this is an initial or a follow-up visit. Check for any danger signs. Then after that, check, for example, if the child has fever. Okay, if they have fever, ask them if they have had measles in the last 3 months. In the past 3 months, and also determine if the child has measles now. Check for the eyes to see for any complications of measles, the mouth of the child. Check if the eyes are draining pus. Very important because of the conjunctivitis, a very important sign of conjunctivitis. Check for any clouding of the cornea. Okay, then classifications, 3 main classifications. You're going to have severe complicated measles, measles with eye or mouth complications, then just measles, based on the presentation of the child. Then try to look at the nursing care or the management of the patient as outlined there. Then if there are any questions, you can try to basically forward them on the WhatsApp group. Then the last part is the prevention, which is very common. So measles is a very common and simple condition that you should be able to go through and be able to understand.